All right, so in this video, I'm going to build on the last two. The first one was about major depressive disorder. The second one was about bipolar 2 disorder. Now I'm going to talk about bipolar 1 disorder. That's a good place to end up with the background knowledge that we now have about the other mood disorders. So bipolar 1 disorder actually only requires one thing, a period of mania. And I'm not saying hypomania. Hypomania is involved in bipolar 2 disorder. So if you didn't watch the last video, definitely watch that. Hypo means like little below mania. Bipolar 1 disorder requires one big manic episode, and that's it. That might happen one time in someone's life. That's rare, but it does happen on occasion. It's just a one-time thing. What is different about mania versus hypomania is that it is much more severe. I talked in the last video about how hypomania is highly functional. It helps people get stuff done, maybe too much stuff done, abnormally large amounts of things done. But it doesn't impair the person's functioning to the point where it's a problem. And it doesn't impair their functioning to the point where they're going to end up in the hospital. But mania is a bit of a different ballgame in those regards. It is extremely impairing, and a lot of people in manic episodes will end up in the hospital. It's a form of a psychiatric emergency. So, it actually has the same symptoms like that I talked about with hypomania, like a period of very high mood or high level of irritability, persisting for several days. Now, this is different. It has to be for a week or more rather than for about 4 days. So it's a week or more of very high mood, very irritated mood, plus like extremely good self-esteem, extremely decreased need for sleep. Sometimes people actually don't sleep at all for like a week, or maybe they'll get 1 or 2 hours, but they do not miss that sleep. They feel completely energetic and able to keep going. Much more talkative than usual, but this is to a point where it's like someone cannot interrupt them. They cannot stop talking, and you cannot stop them from talking. Flight of ideas or racing thoughts to a more extreme level. The ideas may not really make much sense at all, and be even more loosely connected than in hypomania. Distractibility, but this might be like so bad that they can't listen to a person say one sentence. They're just off on something else. Very, very, very distractible. An increase in goal-directed activity or extreme restlessness, or psychomotor agitation, as we call it, or just severe physical restlessness. But this might, instead of like getting a lot of things done, this might look like I am running around rearranging my furniture in ways that don't really even make a lot of sense. Like just a lot of aimless activity. Like it feels like it's purposeful to the person, like they're getting good stuff done, but from an outsider, like they're not getting anything done. They just look like they're moving around, and it's kind of strange. And then it can also involve the impulsivity, and this might look like, and this can look like, and I have had patients where this has happened, picking up and moving across the country, impulsively going on a road trip, spending all of their money, going maxing out all of the credit cards, like really detrimental behaviors, affairs, ruining marriages, like doing very extreme versions of the impulsive behaviors that have a high likelihood of causing severe detriment in your life. Something else that's very different is that, different than bipolar 2 disorder, is that these folks can have psychotic types of symptoms. And this may mean a few things. Sometimes people get paranoid, like people are out to get them, monitoring them, watching them. Everyone knows something about them that, they don't know, or everyone knows something is going to happen, that everyone's in on something, like, those kinds of thoughts. It can actually come in the form of hallucinations. The most common types of hallucinations would be visual, like seeing things that other people are not seeing, or auditory, that's hearing things that other people aren't hearing. Or it can involve delusions, and these are firmly held beliefs that, if you ask anyone else around them, like, these beliefs are not true. This might even be to the point of, like, feeling like they are talking to God, they're a messenger from God, they are God, they are Jesus. It can feel to the person like they're gonna cure a disease, they're gonna become the president in a few days, like things that are, you could call that to some degree an inflated self-esteem, but it's to some level of it is impossible, it's not actually going to happen, but it really feels that way. So yeah, and so maybe, it might be obvious why sometimes these folks might end up in a hospital believing these things, or believing they have special abilities or whatever, can lead to dangerous behavior. At one point, long ago, for example, I had a patient who was in a manic state, not sleeping hardly at all, ended up kind of going outside, yelling at people about paranoid ideas, about the government, etc., just like at night, yelling at people's windows. Sometimes stuff like that leads to being picked up by police, and police will, bring them typically to the psychiatric emergency room if they're able to understand that the person's in mental health distress. So that's the difference. So it has to be just one manic episode, but bipolar 1 disorder often involves all the other mood states I've talked about. So depression, hypomania, and mania, and feeling normal or normative, like in the middle. There's no one way this looks for people. Someone might have a full-blown manic episode and get treatment, and so that never happens again, hopefully. Some people will, have this very often. Some people are manic for months on end. It takes a long time sometimes for the treatment to actually help bring someone down. So you can see why this is much more, severe than the hypomania that occurs in bipolar 2 disorder. So trying to think if there's anything else I would add about that. I don't think so. I think that about sums it up. So that's the more, the more extreme poles version of bipolar disorder.